going to start the next session, which is focusing on digital innovation, examples of good practice and thought-provoking bits about the role of AI, etc. We've got 3 15-minute talks followed by a 15-minute Q&A session. I'm going to be quite strict with the timings with all of the speakers. So to start, I welcome Ahmed Chugtai from Synigma and Holly Green, who is our maternity lead for the Wessex Healthier Together programme, talking about the Healthier Together Paediatric and Maternity apps. Over to you, Ahmed and Holly.
Hi, everyone. I'll share my screen for the presentation then. Me. You're going to have to tell me if you can see it.
Yes, we can.
Oh.
Good news. Just if we make
it's always a relief, isn't it?
Yeah.
Oh, let's start. Oh, I can't get it to play that at the bottom. So I'm talking to you about the Healthy Together app and how we integrated that into maternity services within SHIP, which is Hampshire and the Isle of Wight. So prior to the project, it's a bit about the background. We've got 17,000 births across 4 trusts and 5 sites in the region. And prior to this project, we had all of our day assessment unit calls being answered by clinical midwives working on the day units. And we recognised that had a potential impact on the safety of the women receiving care there and the potential for inconsistent advice to women when they're being answered in stressful situations. Pregnant women reported not always knowing who to call and when, and the calls weren't always answered in a timely way. We're obviously aware of the Healthier Together app in paediatrics being piloted and had good reports from that. So we looked to see how we could integrate the Healthier Together app within to address the issues that we're currently encountering within maternity. So our pathway was like this. So pregnant women and people were advised to download the Healthier Together app at the earliest possible point in their pregnancy. They create a profile for themselves, linking their gestation and their GP practice and their hospital trust, and then the app sits on their phone. If they had any concerns in pregnancy, they go onto the app and they read the information that we've written based on 15 common day unit attendance conditions. The information or the pathway that they see is specific to their gestation, whether we've got an under 20-week pathway or an over 20-week, and it will display the correct information for them. So they'll receive information on that condition, and then they're asked to assess their symptoms, which we then put in a red, amber, green category. If they are green, they are reassured, given self-care advice to stay at home, and or signposted to their local pharmacy if required. If their symptoms are in an amber category, and they are over 20 weeks and it's a pregnancy-related concern, the app links them directly to our maternity triage line. That is manned 24/7, and all the midwives work out of the ambulance station. The calls go through to them and they have standard telephone triage through BSOTs, and then and if required, an appointment can be made directly with their local maternity unit. If their concern isn't pregnancy related or is under 20 weeks, they are signposted back to the GP, and the app knows whether it's in hours or out of hours to be either a GP practice or a 111 call. If the concern is red, then they're advised to call 999 in most instances, or it goes through onto a higher priority call to the maternity triage line, things like labour and TROM. So where the midwives sit within the ambulance station, they can also intervene in those 999 calls if required as well. So that was the pathway that we had, and we launched it on the 28th of November last year. Our hope with the Healthy Together app was to educate and empower women and make informed choices about when and where to access healthcare system, signpost to appropriate healthcare services, provide advice on what red flag signs to look out for and when to seek help. We hope that the app would help reduce the number of calls coming through to the maternity triage line and ultimately reduce the attendance rate on the day units. And we want to improve the quality and safety of the care delivered on the day units and reduce the variations in practice and reassure women when things are normal and when to effectively self-care at home. So these are just some images of what you would see if you go onto the pregnancy pages. You get sort of we call it a blue screen, so an information page on that condition that you click on. If you're asked to assess your symptoms, you then go through onto the red, amber, green. So this is sharing last month's dashboard figures. So you can see the app, Maternity app, is accessed 13,500 times in that month by over 5,000 women. Women are repeatedly accessing it several times in a month, so 2.5 times that month. And you can see that the Assess My Symptoms button was, also the clinical conditions pages were accessed 10,500 times. 35% of those accesses don't go any further than that initial information blue screen. And in 65% of cases, they click to assess their symptoms. From that, only 2% of them are calling the maternity triage line. As a result of that, a 0.1 will be 999. So going through to ambers, only 13% are amber, and they go through to our maternity triage line, and 31% are green. So looking at, of those 10,500 people that access the clinical conditions pages that month, 66% of them were either in the blue or the green section that weren't requiring additional support from their healthcare professional. So you can see that over the trend data since we launched in November, we're consistently seeing it accessed over 13,000 times. We've now got almost 13,000 women registered on the app, and if we continue on that sort of increase, we'd be having our 17,000 by November, what we'd be expecting. You can see the trend data with what the percentage of women that aren't requiring a healthcare professional input after accessing the app. What we've seen since we've launched the app is that the call volume to our maternity triage line is 30% lower than the predicted call volume. And that was based on what the calls were and the individual trusts before we brought them all centrally. And we're seeing, if we compare 2022 data with 2023 data, every trust has seen a reduction in their maternity day unit attendance figures, quite considerable amounts, so 21% over the whole of Hampshire and Isle of Wight. Obviously, when introducing a digital solution, we're obviously mindful of digital exclusion. We had in Hampshire and Isle of Wight, we'd very recently gone over to a digital note system. So we had, it had extremely good uptake. So we felt confident in going down the Healthy Together app route. Internet is a way of life, and it's recognised for those living in poverty. It's cheaper to access the internet via a smartphone rather than laptop and broadband. The Healthy Together app does support lower end and older mobile phone devices and offers an offline mode once it's downloaded, so you can still access the content from that. The feedback from the service in general is really, really positive, and feedback from the app from women has been that it's really easy and simple to use, and that they like the set out of it. The day unit staff are reporting that it feels less busy, and that the women that are coming in are appropriate to be there, and they're enjoying not having the phone calls coming direct into them. So well received. So like I said before, the app started out with paediatric safety netting to access primary care, and they've seen very similar results as maternity, with over 71% of the self triages resulting in self-care and no healthcare professional contact. we are reassured to see that it has a 92% retention rate, which I've been informed is very high for an app to have. And this slide sort of shows how it sort of integrates pediatrics and maternity. So when, like I said, you put in your due date when you're pregnant, and when you're setting up your profile, and then after your due date, you'll receive a push notification during that postnatal period to prompt you to create a child profile so that you can continue to access the safety netting information. And it's a sort of seamless transition from pregnancy into parenthood. I think that might be all I was going to say on the maternity. Yeah, so I'll stop sharing and see if Ahmed wants to jump in with any of his information.
Yeah, thanks, Holly. I'll actually share my screen now as well. Hopefully, should be able to see it now. I actually have some of the similar slides that you have covered, but just to maybe go into some of the points in more detail. So from a digital perspective, so one of the things we actually looked at was that we already had a successful pediatric app which was being widely used. And to extend that to support pregnant women was actually a natural progression for being -9 months. But we actually now see an opportunity over here as well, that after having a positive experience of using the app throughout the pregnancy, we then prompt women at the birth of the child through a push notification to also create a profile for their newborn child as well. And this is actually one of the ways that we plan to achieve almost 100% coverage in the course of the next few years, such that all 0 to 5-year-olds will eventually be have a profile within the app, and the app would be used to assess their symptoms. This is also aligns with some of the discussion earlier on as well around personalized healthcare. This is very much part of our vision. So we believe sort of static information actually presented in the form of just web pages or leaflets, etc., does not necessarily work anymore. Patients do have the expectation to see a doctor. However, in this way, we actually allow patients to actually create their profile. It allows them based on the gestation age, based on where they're from as well. So the pathways can actually differ from one locality to another as well, and they can be actually referred into different places. And the app is actually smart enough to recognize some of those aspects and then provide very tailored, age-appropriate advice amongst children as well. So just looking at some of the data over here, what has been quite remarkable is that we almost have, I think if you were to break down that 17,500 figure, that comes to about the same number of pregnancies that we're actually seeing being registered month on month. So that's why you actually see quite a steep trajectory there. And we're almost on 100% path over here that sort of every single woman is actually using the app, which is phenomenal. It's kind of a way past what we expected it to be. And what's important is not that just any digital innovation happens to be sort of a one-use wonder. What's important is to actually have the engagement rates appropriate as well. So month on month, as you have seen in the previous slide as well, we're seeing repeat use, but also repeat use by the same users on average during the course of the month as well. So they're actually now trusting this as a resource and actually coming back into it as opposed to sort of contacting healthcare services. And this is also the same trend that we see within pediatrics as well. What really stands out in the case of the app is actually the average session duration. That's actually not mentioned in this chart. But on average, we're actually seeing patients spending more than 20 minutes within the app over the duration of their session, which is, again, phenomenal. That's kind of a metric which the likes of Facebook and Tinder would be quite envious of as well. And looking at sort of comparing this to other medical apps within the same category, a conversion rate. So one of the questions in the chat earlier on was about how is this promoted to patients? So the best channel which we've found is actually through primary care referrals. So bulk SMS going after the practice to their children's list to encourage them to download the app. Now, when that message goes out, what we have found is that the conversion rate at the back of that message is about 98%. So immediately that kind of tells you that there is an unmet need that people feel that the app is actually helping to address. And the retention rate is actually important, is that after first use, how many parents choose to keep the app downloaded installed on their phone. And you can see over here, this dotted line represents the median of the apps in the medical category. And this is the trend line of Healthy Together, which is actually sort of quite a bit higher than the median in this space. This is actually what led to the app being one of the most popular apps in the medical category in December when Strep A happened. It was just right behind some of the repeat prescriptions apps and NHS apps and some of the very well-known private sector apps as well. And this is actually purely based on organic growth with zero sort of paid marketing whatsoever. The other thing which we're actually now focusing on is actually how do we embed the app into integrated primary care pathways. So we also have a parallel product, Patient Link, which is used by a number of GP practices across the region as well. We have integrated this alongside that. So for children's health, the app happens to be the first port of call. Equally, practices have actually updated their voice messages to awaiting messages as well to encourage patients to actually download the Healthy Together app in the first instance. And that usually seems to be working quite well. I'm just going to very briefly cover this, but we also collect some data as well, because it's not just about the usage, it's about the outcomes. So we've introduced a patient survey 3 days after the use of the app. Patients are asked about what did they actually choose to do. And I didn't have the time to actually cover all of the topics, but this is actually particularly interesting, which caught my eye, was that some of the patients, when asked, what would you have done in the absence of Healthy Together? Some of them have actually said that they would have actually chosen a green disposition, like care at home as well. And I think that's an important aspect that sometimes gets missed. It's about the clinical safety side of things as well, especially within certain cultures. There's a tendency of not visiting the doctors and maybe relying on advice from family elders and maybe from other non-authentic sources, which can actually sometimes lead to delays in care. So there is no supply-led demand. In fact, a further breakdown of these numbers actually reveals this to be more prominent amongst ethnic communities. So I think in one way, having this resource is helping to bring those communities online and rely on reliable clinical advice as well. And the final aspect is about inequalities. So this is something which actually happens to be the focus of our work moving forward. We have already evidenced, and this is actually based on actual patient data, that the proportion of use of the app amongst ethnic populations and also disadvantaged populations is a lot higher. In Hampshire, Isle of Wight, this is actually what the statistics actually show as well. People who identify as having a first language other than English. And also we're mapping this data onto the deprivation data as well and the deprivation index. And I don't have this as part of today's slide, but again, what we have found is that the use of the app amongst deprived areas is actually a lot higher than some of the mainstream populations. And this comes back to the point which Holly was actually mentioning earlier as well, and this is widely accepted, that the use of smartphone devices is actually a lot more prominent amongst ethnic and disadvantaged populations, because it happens to be the cheapest and the most accessible way to access the internet as well. And one of the features which we have built within the app is to allow for that. So we have an offline mode. So even if you don't have a data connection, you can actually run down to your local library or anywhere you can actually get Wi-Fi. It will download and cache the information locally on your device, and you'll be able to access that anywhere without having a data connection as well. So I'll just pause here. I believe we're out of time, and happy to cover any questions at some stage.